Mary Helen Dellinger, curator of the Manassas Museum system, and we're here today in the McBryde Library, part of our research facility, to talk to you about some of our behind-the-scenes stuff, give you a little sneak peek of what we do back here in basically my office and in the McBryde Library. So follow me. Our mobile shelving that we use that helps us to get the most out of the space that we have. And so I'm going to share with you today an object that I've actually pulled from our offsite storage facility. We keep it here in this special box. So let's go over here and take a look at what we've got. So the first thing we want to do, of course, is put on our white gloves. This protects the oils and the different things on my hands from being transferred to the object. So the top of this box says Medical Kit Surgical. And I thought this would be fun today to pull out, considering the climate that we're in this country and in the world, to see some of the old medical equipment that the museum owns. So I'm going to set these few things out here on the table. So this is a field surgeon's medical kit from the Civil War period. So any battlefield surgeon that was working during the Civil War would have had a kit like this. This is not a complete kit. The lid is obviously missing off of the box, and there's some pieces missing on the inside, but it's largely intact. We received this in 2015 as part of a larger gift from Dr. Charles Poland, who was a collector of all things Civil War. And I think this kit speaks to the bravery of the battlefield surgeons that were here in July of 1861 and again in August of 1862. So let's go ahead and look at some of the things that we have here. It has several different instruments that a surgeon would have needed to perform amputations, and that's what we're going to talk about today. It's kind of a subject that some people get squeamish with, but it's also kind of interesting. Movies, I think, have romanticized what that was like, so we're gonna go over what the procedure would have been for both the doctor and the patient. So it's important to remember that chloroform was invented in 1847. So that did exist, and it was widely used during the Civil War. The whole bite the bullet thing, holding people down, that's generally not true. You would want a patient under some form of anesthesia to make the operation go quicker. And so they would have used it. Supplies may have run low, but doctors did understand anesthesia and how that would work. This is an anesthesia mask right here. We can hold that up so you can see. If you didn't have one of these, you could still use anesthesia. So a piece of thin cloth would have been put over this, and then the entire thing would have been put over a patient's nose and mouth, and the chloroform dripped onto the cloth, and they could have breathed in. If you didn't have the mask, you could just use the cloth itself and push it lightly on the patient's face, and that would basically render them unconscious. And so this is what a mask looks like. And you'll note in this box, this doesn't actually fit in here, so this is like an extra piece that would have come along with this kit. It was not part of the kit itself. So the first thing the surgeon would want to do is make an incision in the limb all the way around, both above and below the bullet wound. And for this, they would have used a scalpel that looks like this. It's double-sided, so you could basically just work your way around really quickly. Again, you would do this above and below the bullet wound, and you would slice all the way down to the bone on the top and bottom. You would also leave a large flap of skin for use at the end of the operation. So this is what the scalpel looked like. Then, after they had made the incision, they would take a bone saw. That's one of these two pieces here. You can see different types of saws. Pretty gruesome looking, this is true. And this is what they would have used to saw right through the bone. I believe, what I've been told, is that this one would have been used for larger bones and this for smaller ones. So if you're trying to saw through like a thigh bone or something like that, you want a heavy-duty saw. So you would try and do that as quickly as possible. Then the surgeon would take silk threads or cotton threads and quickly tie off all the arteries and the blood vessels to stop the bleeding. And then they would use a file this is one example of a file. It's very rough on this edge right here. And there were different kinds. This is just one example. And with the file, they would smooth down the rough edges of the bone where they had just cut away, so it would be smooth as they could get it, and that took a few minutes to do that. Finally, they would take the flap of skin that was left at the beginning of the operation and pull it over the wound and stitch it closed, again using whatever sutures they had available, and then the entire stump was covered in bandages. So that's pretty much how an amputation would work in a nutshell. I'm sure there's finer points to it that an actual surgeon would be able to relate to you. What doctors didn't know was the importance of sterilization. That was not a known thing then. So they would not sterilize equipment in between. They'd use the same buckets of water, the same rags. They'd basically wipe things off, go from one patient to the next to the next. So the mortality rate for amputations was pretty high. If a soldier was seen within 48 hours of being wounded, and that was called primary amputation, the mortality rate was about 28%. That's almost a quarter, more than a quarter of the patients seen. If you had to wait for 3 or more days for a secondary amputation, that went up to just over 50%. So being seen helps your chances. And a lot of that has to do, again, with infection. So if you're waiting for a long period of time, you've probably already got an infection. The amputation is not going to help you anyway. And then, of course, if the infection set in after the amputation because they're using dirty instruments, also not a good thing. So it's important to note, as we look at all these different types of instruments here, that doctors at the time were very well trained. A lot of them had gone to medical school, and they knew what they were doing. Sure, there were some, just like in any other situation, that didn't have good training or any training and tried to pass themselves off as doctors. But most were very well trained and did the best job that they could. The problem was they were simply overwhelmed with numbers of people needing treatment. So you have to figure, if you have a dozen surgeons following around an army, and then you've got thousands of wounded men needing your attention, you're not going to be able to handle everybody all at one time. But what they did understand was the concept of triage. So they may not have called it that, but they did sometimes pass over men that were severely wounded to get to those that they could probably more easily save. So they were trying to save the most amount of people that they could. Realize too that this really isn't an operation like what we would call it. This was just quickly get through something. There was no time to really operate on somebody. It was more like treat the wound, move on to the next person as quickly as you could. So this is our example of a field medical kit. It's not normally on exhibit, so I was very happy to share this with you today. When we cannot be here together in person, and as the museum is closed, so we decided this is what we would share with everybody, and I hope you all find this interesting. And if you have any questions or want to know more about this or would like to see us talk about anything, please let us know as we continue to bring you these videos during this time of social distancing. I'm Mary Helen Dellinger, curator of the Manassas Museum, and I'll see you again soon.